Hello, John. I have looked over your signs and symptoms along with your positive orthopedic test as well as the diagnostic imaging that we have done to determine that you have an L5-S1 disc herniation. With that being said, I would like to present with you this informed consent form. I'd like to go over this form with you just so you can understand what I'm going to do as well as possible alternatives to care if you decide against a spinal manipulation and discuss some other possible complications with you. Spinal manipulation has been proven to be a very safe procedure. In fact, it's one of the safest major forms of healthcare. Studies have even indicated that your risk of suffering from a serious complication following a spinal manipulation or adjustment is very unlikely, but that does not mean that it's impossible. The paper will discuss the most common possible risk associated with manipulation. The bottom line is, chiropractic is a safe and comfortable form of healthcare for most people. If a potential risk is identified, you will be able to be informed and offered either treatment or referral to an appropriate health specialist for the evaluation and care. So some things I would like to go over. Complications will possibly be soreness. It's very uncommon to experience some localized soreness following a spinal manipulation. This type of soreness is usually minor and occurs most often following the initial few visits due to muscle spasms holding bones in the wrong positions. It is similar to the soreness you may have experienced whenever you finished exercising and you went a little harder than usual. A ruptured or herniated disc. There have been reports of herniated or ruptured disc caused by spinal manipulation. Alternative spinal adjusting methods to limit shearing forces are often utilized to minimize the risk and help the patient recover from serious disc herniation pain. The next thing I want to go over is a fracture. Fractures caused from spinal manipulation are extremely rare. So rare that an actual number of incidents per manipulation have never been determined. However, patients suffering from bone weakening conditions are in a higher risk category. Alternative forms of spinal manipulation are utilized for this type of patient if that is the case. Lastly, I would like to go over the possibility of a stroke. According to literature, possible neurological complications can arise 1 per 1 million of adjustments. Alternative spinal adjusting is utilized and necessary to minimize any potential risk. With that being said, studies have indicated that medications like aspirin carry a significant greater risk than an actual manipulation. So, I just wanted you to read over this form after we've went over all of this and just state that you have, been fully aware. If you have any questions to ask me, just go ahead and ask me. We'll get those taken care of. Alrighty, and just sign this form for me, and then we can get going on with our treatments. Thanks.